Turning 65? New to Medicare? You're in the right place. Hi, I'm Anthony Selm with the Modern Insurance Store, and I wanted to show a few case studies of some clients we've worked with just this past week to show how important it is to choose the right agent when you're new to Medicare. Let's get started. All right, so typically with Medicare supplement plans, there are health questions that have to be answered in order to be approved for coverage. So here we have questions for Medico, we have questions for Aetna, Continental Life in Indiana, Philadelphia American, New Air Life, and Manhattan Life Insurance Company. Just a few companies that we work with and represented in the state of Indiana. And with most folks, though, when you're turning 65, you don't have to answer any health questions. You're eligible for what's called an open enrollment period. So there's no health questions that you have to answer, and you can pick any plan or any company you want, guaranteed. The problem with that is that a lot of agents only work with folks who are turning 65, and which is fine, but when these clients start to get rate increases at 67 or 68 or 70 years old, and they want to start shopping the market, the agents are nowhere to be found, and they just don't know how to handle and how to help those clients. So what we do as an independent agency, we work with most of these companies, all of these companies in the state, and we maintain all these questions. So we know that if someone has diabetes or COPD or certain health issues down the road, that there are certain companies that will accept that and won't accept it. And we know where to put those clients and get them the best rate if possible. I wanted to share with you an example here of one client that we worked with just this past week. Her name is Miss Marshall. She's in LaPorte, Indiana, in LaPorte County, and her current plan was with Equitable, a very popular Plan F. She's 73 years old and just got another rate increase. So now her price for her Plan F was going up to $205 per month. This is a perfect example. She'd been with them since she turned 65. Her agent was nowhere to be found. In her case, we found that Plan G was a better value for her, and were able to lower her rate to $133.20, saving her $71 per month. That's $861 over the next 12 months back in her pocket. And we know that because right in the 2016, if you have your Medicare New Handbook, that on page 100 it says that Medicare supplement plans are standardized. So we know that they all perform the same way, the same exact way. They pay claims electronically as mandated by the government. They cover those claims the same exact way because if Medicare pays the 80%, the plan must kick in and pay the other 20% in a nutshell. And they all follow the same network. So any client can go to any doctor anywhere nationwide that accepts original Medicare, and their supplement plan is going to follow them and pay those claims. So in her case, again, we found that Plan G was the better value, and since Plan G is nearly identical to Plan F, the only difference is a small deductible, the Medicare Part B deductible, which is once per year, and for her this year, for 2016, is $166. But the savings was $861. So, I mean, the simple math there just still tells us that it's best for her to put $861 back in her pocket so she could pay the $166 and keep the difference. The next client that I have here is Fred and Jane S. They're in Columbus, Indiana. They were recently new to Medicare last fall, having just did a little bit of late retirement. He was 72, she was 68, and their agent put them with Plan F, again, a very popular plan, with Blue Cross and Blue Shield, and they were paying a combined $424 per month. Now, Plan F is a very popular plan, but in the state of Indiana at least, Blue Cross and Blue Shield is one of the most overpriced companies offering Plan F. So we'd ask the question, so why would an agent put someone on one of the most expensive plans in the market? Well, because it pays higher commissions. That's really it. And this was a perfect example of an agent padding their pockets instead of doing the right thing for the client, just because they knew this client in this case could afford it. But in their case, we also identified that Plan G with Aetna, again, being the best priced Plan G in the market, was best value for them. The total price went from $424 per month to a total of $217 per month for both Mr. and Mrs. And that's a total savings of $2,487 per year back in their pocket. So who do you think is going to earn, this client's trust and loyalty when we can put $2,500 a year back in their pocket the very first year? See, that's what makes us different. We're not in the business of just making a sale. We're in the business of building a relationship with our clients so that we can maintain that relationship and take care of them for the long term. And then finally here, the third case study I wanted to show you was Mr. Carl H. He was in Lafayette, Indiana, and was 73 years old as well. He had been with Mutual of Omaha since he turned 65, so for 8 years now. Another perfect example. Agent was nowhere to be found. He'd gotten rate increase after rate increase and just didn't know what to do. He was paying for his Plan F $360 per month for just one single person. $360 per month. And we were able to get him approved for the same exact Plan F that he had now, but with Philadelphia American, great company based out of Houston, Texas, for $167 per month. This was with the same exact benefits that he had on Plan F already, but $2,315 less per year for a single Medicare beneficiary. So, again, I just wanted to share these with you, just to show you really why I got into this business was to help people and put dollars back in seniors' pockets. And if you're just turning 65 or new to Medicare, being maybe a late retiree and just starting your Medicare coverage at 66 or 67, just keep in mind that the agent who you choose is just as important, if not more important, than the coverage or plan that you're choosing. Because you can see here, this was a difference of, in the first case, $760 a year. The second case was $2,487 a year for a couple. And then the third case was $2,315 a year for a single person. So it makes that big of a difference, 2, 3, 5 years down the road, to know that you're going to be taken care of. And if you get an increase, to know that there are other options available. If I can help you, my number is listed here below. You can call it, which is 866-572-9255. Thanks, and have a blessed day. Take care.